of them. Listen. This virtual trainer indeed is changing lives. We have so many nursing students in them. And I'm really excited because you guys know what? We have the ReMar party coming up very soon. And so if you want to join, it's super simple. All you got to do is pass NCLEX. All right. But check out the website, remarnurse.com/party. If you want to join. I'd like to get into my questions now. Hey, everybody. The building. Yes. New Jersey as well. Thank you guys so much. It feels so good to be back and to have you here. Los Angeles. I know you guys are rocking with me today. All right. So are you ready? Are you ready for the first question? Here it is. Okay, here it is. Question number 1. This is fundamentals nursing. We have an 80-year-old client diagnosed with depression, suddenly experiences delirium, sleep disturbances, and disorientation to person and place. The laboratory results indicate the client has dehydration and a bladder infection. After communicating the assessment data to the healthcare provider, what should the nurse expect to be as a priority action? Okay, here are our choices. You guys got a lot of information about this patient. Number 1, in order to place the client in restraints for safety. 2, in order to reassess the client's mental status. 3, a request to notify the family of the current condition. Or 4, in order to transfer the client to the medical unit. What do you guys say is the expected priority action for this patient? I see a lot of 2s. To reassess the client's mental status. Yes, okay. I see a lot of 2s. I see 1, 3. To notify the family. What is the priority here for the nurse to do? This is a fundamental medical priority question, right? So you have this patient here and you got a lot of information about the patient. All right. So what is the priority here? All right. And look at the diagnosis. So you have a patient with depression. All right. Let me stop talking before I give it away too much. But the patient's diagnosis is very important here. Sometimes you can get the answer by just really reading the stem. All right. So I'm going to reveal the answers to you guys in 5, 4, 3, 2, 1. Here it is. The correct answer is actually number 4. It is actually number 4. You say, how, ReMar? How is it number 4? Well, we need to get the client on the appropriate unit. Yes, this client has had some physiological changes. So they came in with a diagnosis of what? Depression. So typically clients, certain kinds of treatments that they can be carried out. But this patient has now had some changes, right? So not only are they depressed, but now they have sleep disturbances, right? Disorientation, they're dehydrated, they have a bladder infection, and they're 80 years old, okay? So yes, I see the comments. They need medications. They need IV treatments. Are you going to be able to have that? Are you going to be able to have that on the psychiatric unit? No. You don't have patients walking around with IV poles, with active medications, and you have other patients with psychiatric issues around them. No. We're going to have to move this patient to the medical unit. Yes, a lot of people pick number 2, which says to reassess the client's mental status. Now, that sounds great and it looks great. But remember, the question is always, what is the best action? What is the most safest action, right, for NCLEX. And so we don't really need to assess the mental status. We already know what the patient's mental status is because it says they're what? They are confused to person. They're confused to person and place. The doctor got that. They don't need you guys to tell them that again. All right. So the priority action is to get this patient off the psychiatric unit, put them where they can get the medical attention that they need. All right. All right. Good job, guys. We are moving on to the next question. All right. Here's the next question. Let me show it to you guys. Okay. It says this. It says, a nurse receives morning report. A nurse receives morning report from highest to lowest priority. In which order should the nurse assess the following clients? You got to use all options. So client number one is the client with diabetes mellitus who has questions about discharge. Okay. 2, the client with hepatitis who became confused overnight. 3, the client who is 48 hours post-operative following a cholecystectomy and has a T-tube inserted. 4, the client with a migraine headache requesting pain medications. So what's the order? Who you see first, who you see second, who you see third, who you see last. You got to use all of them. Put them in order. Let's go. Let's go. Let's go. I see. Okay. I see some consistency in the answers. A couple people are putting the same thing. That's great. Here we go. Who's the first patient? Who's the last patient? Who's the first patient? Who's the last patient? All right. You got to use all options. All options. Okay. All right. And this is like typical drag and drop priority. But what this does is it allows you to demonstrate that you do understand a great number of physiological conditions. These types of questions really show that you know nursing, right? All right. What's up, everybody? This is Monday Motivation. You made it here live. We're in the midst of prioritization right now. And it's looking good, actually. It's looking really, really good. All right. You guys are locked in, loaded. Smash that share button because this is a good one today. All right. Okay. I'm going to reveal the answers. Let's do a countdown. 5, 4, 3, 2, 1. Here we go. The answer, the order is 2, 4, 3, and 1. Yes. So why is it? Yes. Number 2. 2 is the first priority because this client has a change. This client has an acute change. Overnight, they became confused. Now, when we're talking about hepatitis, Tori value, could it be a pneumonia level? What is the issue? Is it sodium? Is it a bleed in the brain? We don't know. But number 2 is your priority. Okay, you got to see that patient first. The next patient that you will see is the other patient. And this is where people got tricky because a lot of people pick 3 next. But at the moment, there's another patient who has a need. All right. This patient has a need. They have something that you need to do. And we have a patient who is requesting pain medication. All right. They have a need. They need you to go to them. So it's going to be 4. All right. Then 3 says a lot, right? 3 says a lot. So you think, okay, this patient got a lot going on. I need to be there. But actually, there is no need that is evident. All right. You just have a lot of information. The client, they've been out of surgery for 2 days. All right. They had a cholecystectomy. What's a cholecystectomy? Does anybody know what a cholecystectomy is? All right. Because if you don't know, then you're like, oh, I don't know. What is this? Did they have their brain removed? I don't know. This is where content really comes into place, right? So they had a cholecystectomy I don't know if this is a major surgery or a minor surgery. What is going on? All right. So a cholecystectomy is the removal of what? Right? So they had their gallbladder removed and now they have a T-tube inserted. What's the T-tube? All right. So essentially this patient right here is stable. That's it. They're stable. They had a surgery 2 days ago and they have a T-tube inserted, but nothing here compels me to go to 3 before number 4. All right. So 3 is the third patient. And then 4, this patient is asking about leaving. Anytime you see somebody with questions about discharge instructions, waiting for discharge, already been discharged, transferring to a discharge place or transferring to a rehab or a step down, these are all indications that the patient is stable enough to leave. Okay. So this is our last patient, and pretty much everybody got number 1 was going to be last, but there was a mix between 3 and 4. All right. So this is the correct order. All right. This is the correct order. I'm so glad that you showed up. You might see this on your NCLEX exam. All right. Let's do another question. Let's do another question, shall we? I'm filling the priority. This question says, a nurse receives night shift report. Which client should she see first? All right, ReMar family, here you go. Number 1, a client with an abdominal hernia requesting pain medication. 2, a client with fluid overload and hyponatremia. 3, a client with acromegaly and a history of heart failure. 4 says a client 18 hours post thyroidectomy and a heart rate of 110 beats per minute. Okay. And I am going to put that in here so that we know here. Okay. Let's do it from here. Let me show you guys this one again. All right. Here we go. So number 4, I had to make an adjustment to it. A client 18 hours post thyroidectomy and a heart rate of 110 beats per minute. What do we think is the correct answer here? All right. Got a lot going on with these patients. Patient number 1 has an abdominal hernia. Patient number 2 has fluid overload and hyponatremia. What do we know about that sodium level? What do we know about that sodium level? That heart rate? Are you worried about it? 3, client got acromegaly. Y'all know what that is. And the history of heart failure. This is deep. Okay. And then 4 is 18 hours post thyroidectomy. Is that a new surgery? Is that considered a fresh post-op, or is that considered kind of delayed? And they have a heart rate of 110 beats per minute. Is that okay? I know, is it kind of tacky? Is there a range? It's not normal, but is it concerning you? Ooh, this is a good one. This is a good one. And I see all kind of answers coming in, but what is the priority here? All right. I'm going to reveal the answers. I'm trying to get you guys to change your mind because I know a lot of you struggle with that. I don't want to be able to sway you. Go with your gut. Go with your gut. Whatever you think that is. All right. Whatever you think that is. Okay. The correct answer, I'm going to reveal it to you right now. Yeah, I'm going to reveal it to you right now. Okay. I waited long enough. Okay, so here we go. The correct answer is actually going to be number 4. It's number 4. Absolutely. What concerns you? I like Mona. Mona's like, 4 concerns me. Yes. All right. So number 1, not too many people pick number 1. I don't think anybody picked number 1. But the patient with the abdominal hernia repair, What are they requesting? Pain medication. So pain, of course, is psychosocial. Psychosocial pain is not going to come before a physiological change, right? Acute bodily change. The pain can wait, because if it's expected pain like we have here, if you have an abdominal hernia repair, that's going to hurt. So the pain is not abnormal. And so the mindset is that you will not die from this pain. It's expected pain, right? So this is not going to be our priority. 2, and I tried to get you guys, because I saw a lot of people going for number 2, and I'm like, yes, y'all are totally distracted. Fluid overload and hyponatremia. Now, this could be acute, but it is not life-threatening, all right? So this was an acute change, and I think a lot of you guys saw it, like, fluid overload, low sodium level, right? And I talked it up. I said, what about the heart? What about the cardiac, right? So this was an acute change, but it was not life-threatening. There is another condition here that actually could be life-threatening, okay? And so that's why this one, it looked good, but it was a distractor. All right, 3 is this patient had a chronic condition, acromegaly is chronic, and a history of heart failure, chronic. And so chronic conditions are not going to be the priority over the acute conditions. So thyroidectomy, thyroidectomies are serious surgeries. They are not ever to be taken lightly, especially within the first 2 days. All right, especially within the first 2 days. So 18 hours, this is the first day that this is done. So you have somebody who had their thyroid gland, whether it's total or partial, removed, and now they have an abnormal vital sign. What is going on with this patient? Why is the heart rate 110? We don't know. We need to go there. We need to see, because this could be totally life-threatening, could be thyroid storm. I don't know. Could be a hemorrhaging issue. I have no idea. And so I need to go there to figure out this patient. Does that make sense? Does that make sense? All right. And so this is what we do. Monday motivation. This is how we change the nation. All right. This is how we change the nation, by knowing our fundamentals. All right. So. Another thing that I want to show you guys is, because thyroidectomy, thyroidectomy is one of those conditions you have to know for your NCLEX exam, particularly the related complications. So I want to give you guys a list of those complications that I studied this weekend, and I want you to know what they are. And so thyroidectomy, possible complications, of course, we do go over thyroidectomy in the virtual trainer, but this definitely is something that everybody in the ReMar nurse family needs to know. So the possible complications, hemorrhaging, absolutely. And the telltale sign for hemorrhaging is going to be frequent swallowing. So if you see that in your NCLEX question, you know what time it is, people. You know what time it is. All right. Hypocalcemia or tetany. I saw that in a lot of your answer responses today. Yes, if the parathyroid glands were accidentally removed or purposely removed, you're going to have tetany. You're going to have low calcium levels. And so you guys should be able to make the connection between A, thyroidectomy, and the possible complications, which are B. You need to be able to do that before you take NCLEX. If you cannot do that with any of these things, it's a weak area and you need to prepare for it. Okay. All right. Respiratory distress or stridor, respiratory distress and or stridor is going to be related to thyroidectomy. How? Know how. Vocal cord paralysis, very easy to hit a nerve, hit the laryngeal cords, right? And so NCLEX will say the patient has aphonia. They can't speak. All right. This is a complication. You should be able to speak after a thyroidectomy. Okay. All right. And then 48 hours after the surgery, anytime you have an infection, infection does not take place right away. An infection is always a late term condition, okay? A late-term condition, because it takes a while for bacteria to grow. So never choose infection over laboratory changes, because it takes a while for the bacteria to grow, okay? All right. Now, you know what? You guys did a great job. I'm thinking I might have to come back this week. I'm thinking I might have to come back later on this week and get you guys into some more questions. The year 2020 is closing out, and we have to get even more serious about passing our exam. So I'm back. I'm feeling good. I'm feeling loose. It's time to give our ReMar nurses their roses. And the roses today are going to be different because actually we had so many nurses get into the VT that I just want to give you guys all roses for making that transition. All right. Out of the world and into the virtual trainer, where you have your dedicated information. So you know what? Congratulations. We have more than 650 nurses who joined in the virtual trainer this weekend. Isn't that crazy? That is insane, right? That's like over 600 nurses. Are you one of them? I don't know, but I would want to welcome you to the family. Some of you might not even know what the virtual trainer is. You're like, what is the VT? What is it exactly? So I want to show you guys, before we go to our Monday motivation, just a quick video on studying the NCLEX virtual trainer. Now, if you have the virtual trainer, if you just got it, and you have not watched this video, you need to watch it, because I explained to you how to study the virtual trainer. So let's get into it.
In this video, I'll cover how to study with Regina, your virtual trainer. Your NCLEX review is a combination of online lecture resources and physical books. You will receive access to my virtual training platform and two of my best NCLEX resources, the NCLEX VT Student Workbook and Quick Facts for NCLEX. Now, once you're in the program, it's time to head over to the File Vault. In the File Vault, you will be able to download and print your daily study calendar. You will need this calendar because it is your roadmap for the next 60 days. The File Vault is also a place where I have uploaded other documents that will help you study for NCLEX. You can download and print them at any time during your NCLEX review. Once you have your calendar, you are able to view your study guide. This calendar is an ideal example of what the 6-week study program should look like. For example, on week 1, I have a start time, a study duration for each subject, and an ending time. It's okay if you change the times to begin and end your study session, but you must not change the subjects or study duration that are in place for that day. The calendar is for the first 6 weeks. Any additional time that you have in your virtual trainer should be used for content review. Now, let's go through a sample day. Let's look at week 1, day 4. It is the Thursday of the week. You should enter the VT Center and open your student workbook. The schedule tells us that we are to watch the first chapter, Pregnancy Overview, while taking notes during the video. Continue on this way to the end. The calendar also states that day you are watching the Labor and Delivery Overview. So we will take lecture notes in our workbook as well. As we turn the page, we will come to the clinical judgment activities in the student workbook. After you do your clinical judgment activity, you will find the answers at the bottom of the page. Try to do your clinical judgment activities with no help and then check your answers. Okay, now according to our calendar, it's time to look at our companion book, Quick Facts for NCLEX. You are instructed to complete the pre-test, planner page 1, and then study pages 1 through 10. You will notice that the Quick Facts book is in question and answer form. So some students like to fold a page of quick facts over to see if they can answer the questions that are being asked. Once you have completed with reviewing pages 1 through 10, the pharmacology section and the back of the quick facts should be studied according to the calendar as well. In ReMar review, I have you studying the pharmacology right from the beginning because pharmacology is like learning a new language. So, according to the calendar, you will study the following medications: allergies, analgesics, and antibiotics, and anticoagulants. This will conclude your studying for the day. Each day, you will do the same process. Some days, according to your calendar, there will be no work assigned as you are to rest. At the end of your training, you will have finished the lectures and now be positioned to do the practice exams. Remember, the practice exams are meant to help you identify weak areas that require review. For each practice exam and review, try to achieve the passing goal. It is a good indication that you're ready to take the actual test. If you would like additional practice questions, ReMar has you covered. Try our online NCLEX question bank. It is the best question bank if you want to experience the NCLEX before your test date. Here are some other studying tips. Never try to pair the virtual trainer with another NCLEX review company. This will cause confusion in your content knowledge, increase your overall study time, and leave you less confident in your knowledge due to not giving one resource 100% dedication. Try to reduce distractions such as cell phones, television, and music, and allow your mind to be totally focused on the material at hand. Also, do not eat or drink anything during your study session, as this also divides your attention and could possibly cause you to have frequent bathroom breaks. Choose study times when you are most alert, whether it is in the morning or late at night. Next up, on your rest days, explore the motivational resources so that you can stay on track with your momentum. Well, I hope you've enjoyed this video explaining how to study with the ReMar virtual trainer.
Hey, so I am so glad we had some time to go over how to study properly with the virtual trainer, because indeed it is like nothing you have ever seen before. And I want to make you feel comfortable with your new learning resource. If you don't have the VT, it's not too late. 2020 is still in play. You got time. 3 months access. You can get physical workbooks. I'm talking about my books I created just for nursing students. You get the daily study calendar. Plus, we have a 99% passing rate for this program. If you do it the way it's supposed to be done, I'm telling you, success is right there for you guys. So with the program, you get the VT student workbook plus my quick facts book. Love these resources. Created them just for nursing students who just want the straight truth about how to pass NCLEX. So if it's you, let's go. Let's sign up for it. Get in the family. Now is the time. ReMarNurse.com. Connect with me that way, please. We do trainings all the time. I don't want you guys to miss anything that I do. We always are constantly engaging our students so that they have success. Now, I want to talk to you guys about our next Monday program, which is, well, next Monday, meaning today. We got to talk about our motivation. Hey, who are you voting for? It's not what you think. It's not what you think. All right. I know that this is a big week for Americans. All right. I know we have international audience, but this is a big week for America because for the last couple of weeks, the country, we have already been voting for the next president. All right. We've already been voting for the next president. And I don't need to know who you guys are voting for. All right. It doesn't matter to me. But when I listen to the top candidates, honestly, they're saying the same thing to me. They're saying the same thing. This is what I hear. They can be trusted, right? You can trust me. And this is not just with this presidential election. This is like all politicians, right? Anytime somebody needs your vote, they'll say this. They can be trusted. If you give me a chance, things will get better. All right. And they say that they have a plan for you, a plan to look out for you. Right. Is it just me or do you guys agree? Right. This is what you hear. Right. This is what you hear from somebody who wants your vote. Right. And so this is my Monday motivation for you guys, that no matter who you vote for yourself too. Okay, vote for yourself. And this might be like, what do you mean, Regina? But I'm just saying, like, no matter who you vote for president, guess what? You are still the CEO of your own life. All right. You are still, you're the best candidate for yourself. Why are you the best candidate? Why you need to vote for yourself? All right. Is because you have the propensity to change your life no matter who gets into office. All right. You have a career in nursing waiting for you. Nursing is always in demand, no matter who runs the country. Didn't you guys, I don't know if you guys noticed this, but we had a pandemic during COVID. Nurses were so in demand. You guys saw the job opportunities. All right. You guys saw the job opportunities that I put on Instagram, where literally they're like, hey, make $4,000 a week, make $5,000 a week. We need nurses so bad. And so, when you're looking at placing your faith into these people in office, you guys have the best chance of determining your future. And it's not based on what somebody else can do for you, but literally what you have inside of you, what you have already worked for. All right. And people say this, if you want something done right, what? If you want something done right, if you want your future to look a certain way, if you want to have certain things, you got to do it yourself. If you want something done right, you got to do it yourself. I'm telling you, you cannot. You guys saw when I brought my kids, up. My kids want certain things. They need to have certain things. Our household need to have certain things. I cannot depend on President Trump or future President Biden to get those things for me. Like, that's just not going to happen. I have to work hard. I have to sacrifice. I have to commit. And so do you guys. We have to place our faith in, the God who provides for us. And what I'm trying to say is that, this week we will hear a lot about voting. But honestly, you guys have to vote for yourselves by still committing the year 2020 to getting your nursing license. Okay. Still committing the 2020 year to getting your nursing license, because honestly, no matter who gets elected as president, if you have your nursing license, your future is going to be a lot more secure than if you don't. All right. No matter what stimulus package is coming down, you can't wait for the stimulus packages. You can't wait for, some sort of a government assistance to get it done. You guys are in control of what happens. Right. So we've been putting this graphic up and you guys saw it. It's just the average income for nurses at every level, right? For the nursing professionals. And it's just a reminder that whatever sacrifices that you have to pay, whatever you have to give up temporarily will return you dividends, right? Will be much greater. They say that your ladder will be greater. You've given up for the process. And we've seen that in a ReMar community where you guys can give back to each other, and you're buying each other virtual trainers, and you're putting up pictures of your houses that you purchased and your cars and things like that. And so I just want to remind you guys that whatever small sacrifice that you're temporarily required to do this week, cast it as a vote for your future self. All right. Your future self will thank you for investing in your current self. All right. And so that's what I want to say. If you didn't get the virtual trainer, it's an investment, of course, but it is so worth it when you get that license. All right. When you get that license. And all I'm asking you to do, just like I see, just do your best. All right. Just do your best. That's all. Commit to giving yourself the best. Just like we look at these presidential candidates and we hope for the best and we say, oh, I know if I choose him, he's going to look out for me and things will be better. I need you to look at yourself in the mirror and have those same benevolent thoughts about yourself. Like, if I choose this girl, she's going to do the best for me. If I invest in this person, she is going to work it out for my good. Right. And so that's what we're doing this week. Hey, also, don't forget, when you pass NCLEX, we got the party coming up. So there's so many reasons to invest. That party is coming up soon. I definitely want you guys to be a part of it. All right, we're going to bring you on. I have some gifts for you, things that I don't typically give away, but I'll have just for the party people who passed their NCLEX exam. Also, don't forget, let me grab this. Your ReMar nurse shirt is yours. Once you pass your NCLEX exam, send in that testimonial video and it's yours. We send it out to you, whatever size you need. Actually, if you've passed NCLEX with ReMar, can you put it in the comments, I passed, so we know, and what size shirt you need. And so Team ReMar can get on those comments for you guys. But yeah, we have an amazing rest of the year planned for our ReMar nurses. I'm so excited about this time of year because we have so many events. So if you are not connected to ReMar, please go to the website, remarnurse.com. And then you can give us your information. And so you never miss any of our events. I see people saying that they missed this, they missed that. They want the notes from this. And so if you sign up, hit the notifications bell, make sure you're in our family email system. Okay. Then, you won't miss our special events just for you. Thank you guys so much for coming to Monday Motivation. We'll be back at it again next Monday, as we always do. And then also, I will be popping up throughout this week to make sure that you guys are on task, because 2020 is closing. And this is the year that you said you wanted to get your license. And I believe that you can, you will, and you must pass NCLEX. Pow! You guys can do it. Party coming. Don't miss it. Yeah, I want to see you there.